Understanding how and why hair loss happens can greatly improve your communication with your clients. Our learning objectives will be to give examples of the common types of hair loss and explain what can cause hair loss, and to identify and explain at least 3 options for hair loss treatment. Normal hair loss is the result of the hair's natural growth cycle. Natural shedding should measure 35 to 40 hairs per day. Any hair loss more than that could be signs of irregularities. People who suffer from abnormal hair loss suffer from emotions such as feeling less physically attractable, feeling less assertive in their everyday behavior, feeling like they are less successful in business matters, feeling less likable or less sociable, or feeling that they may appear older than they really are. There are 5 main types of abnormal hair loss. The first is known as androgenic alopecia. Androgenic alopecia is the miniaturization of terminal hair into vellus hair. Androgenic alopecia can be caused by genetics, age, and hormonal changes. Androgenic alopecia can begin as early as the teen years, but is more frequent by the age of 40. By age 35, almost 40% of both men and women will show some degree of hair loss. Androgenic alopecia is commonly referred to as male pattern baldness in men. It usually progresses to form a horseshoe-shaped hairline. For women, androgenic alopecia typically shows in a thinning of the crown area. Alopecia areata is an autoimmune disorder where the hair follicles are attacked by the person's own immune system. This type of hair loss can affect almost any part of the body. Alopecia totalis is complete hair loss of the scalp. Alopecia universalis is complete hair loss of the entire body. Postpartum alopecia is a temporary hair loss experienced at the end of a pregnancy. Pregnancy seems to disrupt the normal hair growth cycle due to hormonal changes. Generally, there is very little hair loss during the pregnancy, and a sudden and excessive shedding of the hair at the end, and sometimes up to 12 months after the pregnancy. The growth cycles generally resume back to normal within 1 year after the baby is delivered. Minoxidil is a topical, over-the-counter medication used to treat hair loss. Rogaine is a common, name-brand, minoxidil product. Minoxidil products generally have no serious side effects. Finasteride is an oral medication for men only. Side effects include weight gain and loss of sexual function. Women who may be, or may become pregnant, are strongly cautioned, as this product has a strong potential for birth defects. Once a client stops using a finasteride product, the hair loss continues. Some experts say that as these medications interrupt the normal growth cycle, once a person stops using these products, they lose all of the hair they would have lost during the time that they were using the products. Hair transplants are another hair loss treatment option. Only licensed surgeons may perform transplant surgeries. Clients interested in hair transplant options should be aware that several surgeries may be necessary to correct the hair loss issue afflicting them, and each surgery can cost up to $20,000.